I thought he was going to say the takbir for a second then. I'm just... Okay. Are they clean? Are we clean these or do I need to clean them? सी साफ कर लाला सी साफ कर Okay. That's fine. That's fine, I don't need the smaller ones. That's it. Okay, to demonstrate, first of all I'm going to show dry cupping therapy and massage cupping therapy. Okay? So for this we don't need to use any sterilization or anything like that. Do we have any oil?
Yes. Where is the oil?
Where is the oil? Okay. Oh, nice olive oil.
Afia.
Yes. With some nice salad.
Yeah, for salad.
Yeah, I will do the dry first.
Why did you use the
For the massage. So, ab theek hai Alamin bhai? Theek. I'm just going to, so imagine he's got, let's say, cervical spondylosis or he's got neck pain. I would know you would treat the upper trapezius muscle and the scalenes muscle. So I will just treat the upper trapezius muscle here. So this is not sterile procedure, it's not a clean procedure, we just have to be, I can wipe over the same area a couple of times. And this is to encourage lubrication. Can I have this cup? This is fine. And
why did you use the chlorhexidine instead of the olive oil?
on here, this is just for dry. This is for dry cupping therapy. So I'm just going to show. So with massage cupping therapy, it's light suction. So you can see I've done just two, like 1.5 suction, and I will just start pulling. When you start pulling the skin, it should roll naturally. ये कैसे आपको लग रहा है? ठीक है, आराम है. So you can use that, and depending on where the trigger points are, so you've done your palpation beforehand, you felt the trigger points, you will work in that area. So you know the line of the muscles. So centrally the trapezius fibers are like that. Then they go off to the angle. So you work with the angle, and depending on where the restriction is. So if he has, for example, a restriction in shoulder elevation, so you can do it with the range. So as he's moving up, take him to the range and pull out and in. Do you understand?
Yes.
To increase mobility and flexibility of the shoulder joint, yeah. And you can take it up, to use a smaller cup, you can take it up towards the neck. He's got small hair, so olive oil and suction would be enough to even provide treatment for the mastoid muscles as well.
So do you move upwards?
You can move upwards as well. You can be depending on the fiber the fiber types. So depending on where you want to go. So if you want to use, can I have some olive oil again? That's fine. Thank you. Okay, so a lot of people who have like occipital headaches or tension headaches, you can use the same thing with them. So use a smaller cup, and we will go up towards the neck. It's important the patient keeps the head in a neutral position. Again, so I do it, single suction is enough here. And I will go up towards with the muscle fibers. When you're lifting up, be sensitive how the muscle fibers are going up. You're going vertically, so you will lift from the bottom and massage. ये कैसे आपको लगता है? दर्द है या आराम है? So he says that it's relaxing. And we're going over to the occipital muscles, and you got to be careful when the hair comes. You can try the suction again. If you want to shave that area, you can shave that area as well. It's quite good for them. It's coming off fairly quickly, so normally I should shave that. But you understand the principle, right?
Yeah.
And especially you get a lot of trigger points up here in this muscle, that muscle, in the upper trapeze. Sorry? No, it will not leave bruise, because can you see the suction is light. So can you see the amount of redness you can see here is mild bruising. It's not dark colored. That level is okay. If it goes darker than that, then you're sucking too hard.
One trigger point. What do you mean by trigger point?
So trigger points are myofascial trigger points. So if you imagine if you feel this upper trapezius, he will have an area in there which is quite sore. If you press here, यहाँ आपको दर्द लगती है?
The most tender part.
यहाँ जोर दबा के. So yeah, so it's quite a sore area for him. And when you feel it, it feels like a hard section of muscle. That hard section is what we call a trigger point, where the muscles don't relax and contract properly. After a while, you get scar formation, and it starts feeling like a knot. And if you press down, it says it hurts. It's not bone. It's not.
You do a massage.
You can do massage there, and you can leave some. You can even leave the dry suction on there for a while, and depending on the angle of the fibers. So if you remember your anatomy, the trapezius runs like that, and like that, the upper fibers, and then like that. So you will massage according to the angle of the fibers, because you want to get the fibers to return back to their normal original position, and that's the muscle relaxation theory, right?
Regarding the anterior sternomastoid, because here we are not.
You're not cutting, yeah. So you could do the sternocleidomastoid as well, but just be careful that you don't do two at the same time. And don't go too anterior towards the throat, because you can actually cause dislocation of, you can cause a choking sensation. And this, unless you get really experienced with this, at the beginning, I would say avoid it. Yep.
Sorry to ask about joint pain.
And sorry, just 1 second. Also, if the patient's elderly, they'll have vertebral basilar artery insufficiency. And if they've got a clog or they've got a blockage in there, you can trigger it off. So we say avoid the anterior angle unless you are confident of what you are doing. Sorry?
About the joint pain, how we do, how to detect, how to know the trigger point, how to do the massage.
How to do the massage for the joint pain. So for example, let's say he's got shoulder pain. I think I was going to show that tomorrow, but I can show you today. Frozen shoulder.
Frozen shoulder.
I was going to show that. Have we got time to show it today?
Today is just the purpose, is just to do, so they have an opportunity to practice it.
Yeah.
Because there'll be an exam, you'll be tested on the practice.
On the procedure.
So show them the actual procedure.
Show them the actual wet procedure. Yeah, I think on tomorrow morning I will show the adhesive capsulator, frozen shoulder, and the points.
Here, asking about the sinusitis. And,
Yeah, dry cupping therapy is good for that. So you can do that with the dry cupping therapy with the smaller cups. Take it across the room.
Massage, doing the massage.
Doing the massage, yeah. Don't do the wet cupping, because dry cupping therapy is very good for that itself. And you can do it around the orbital muscles. And you can palpate the orbital muscles where the trigger points are, where the tender points are. And do it around there.
Just use a very small cup, put lots of oil on, light suction, and then just like this. You can even get a cup smaller than this.
Okay.
Even smaller
Yeah.
than this. Maybe like this size. This
Yeah, probably in the box. There's one even smaller, yeah.
Just here, just there, all along
And
here.
inside of the eye, so around here, and the lacrimal gland, and
No.
there.
Some people
You can get
Small
one
is
cup smaller than this.
More
But
patient,
even
they
for
have
you, this size would probably be
pain
okay.
in this side after they sleep, maybe for 2 hours. After they sleep, most of them.
Yeah.
Or take
Heavy lifting, yeah.
But this is good for me, or hijama only we can do it.
You can do, but if you feel it,
Most of them they have
Yeah.
something, they have the pain in the bones here.
I
problems.
if they have a problem just in the muscle, I recommend doing dry cupping therapy first to relax the muscle, to get the muscle to relax, and then
wet hijama.
no dry. Dry first,
Ah.
2 or 3 sessions, and then you apply the wet. It will be much better. If you do wet directly, the trigger point will not go away in one session. The trigger point needs time and relaxation to go away. Sometimes it goes away in one session, but usually trigger points take a few sessions. Okay, so I will demonstrate now the wet cupping therapy procedure. So we're assuming that everything is correct, the patient is okay, the equipment is sterile, I have everything ready. I will just demonstrate the procedure itself. Okay, so this is the area that I will apply cupping therapy onto, because as we said yesterday, we have 3 points which are what we think is sunnah. So there's a C7, which if you ask the patient to feel the C7, it's the most prominent cervical vertebrae, like that. And as he goes in, as he goes backwards, it feel it going inside. So this is the C7 area. We will apply the cup
You put it here or here?
around, right there. Okay. And then the inferior angle of the scapula. So to feel the inferior angle of the scapula, can you bring your arm back? And you can see the inferior angle like that. We will apply it in this, in that level, bilaterally. So I will apply it here.
Sorry, I cannot see, sorry.
Yeah, you have to come. You have to come that side, unless you've got X-ray vision, like that. So if you see the scapula, inferior angle, palpate there. It's roughly T10, T11 area, T8 to T10. We apply the cup in this region, bilaterally, so the triangle like that. So there are difference of opinion. Some say between T6 to T10, but we think anywhere between T8 to T10 is absolutely fine. Okay. Some people say that area as well, but for our teaching purposes, yeah. Some people say that it's these two areas plus this. We say it's this area plus these two. This is our opinion. But yeah. Okay, so now demonstrating the technique. So I will first of all apply the spray onto the area that I want to treat. आप आराम से बैठ सकते हैं. बाजू आपका ठीक है? Yeah. So I will spray the area that I want to take spray, and then wipe in a circular motion. Throw that away. Put that there. Now I need a cup.
You already sterilized the cup.
Yeah, the cup has already been sterilized. I said that at the beginning, so everything has been sterilized for me. I will just apply the procedure. So I know we're in the right place. Apply the cup here, stabilize the patient, and then 1, 2, and because this is a weak diaphragm, I will apply that much. So, and then twist the pump and pull. Okay, I'm checking to see if it's on properly. It's on properly. We wait 3 to 5 minutes or until we see discoloration. If it's adequately red, you can take it off earlier. So you don't have to wait up to 5 minutes because everybody's skin circulation is different.
What the physiology now? The blood comes in this area?
So the blood is pooling in this area. We get reactive hyperemia. So we got local hypoxia now. Reactive hyperemia, local hypoxia. We trigger off the hypoxic gradient nitric oxide pathway. We're triggering off also the pain gate theory. In addition, because this can also be relaxing. It's providing pressure and compression. Large fibers sending message to the pain gate. Mechanotransduction has started. So I would like to wait maybe 30 seconds more because he's got good skin circulation. Yeah, it's the first time he's doing it. And normally people who are physically active, so in a job like that, they're physically active, their skin circulation will be good. I'm just looking at the blade if it's okay.
Just in case we have a scenario where he does faint and he becomes clammy, we just ask everybody to step away and then we'll put him onto his side and put to rest, just in case.
आप कैसे हैं ठीक हैं कोई मसला तो नहीं ठीक I'm checking with the patient if he's okay there's no problem with him I think his skin coloration is decent now in relation to his natural skin tone you can say it's adequately red I place the cup back onto a sterile place
One blade ready for you, this one here.
this one here so I will take that blade like that. Pull it out.
This is 11.
Sorry?
Big.
It's okay. It's okay. I will stretch the skin like that, and using the Langer line. So one of the things that we mentioned in your notes, can you see when I press your skin, the Langer lines are in a slight obtuse angle, nearly 40 degrees angle. So I will make my cuts at that angle within the area. So. Okay, there we go. Where's the sharps box? Okay. That's there. Grab the same cup.
عليكم السلام ورحمة الله وبركاته. يا أهلا وسهلا. تعلم ولا بعده؟ شوي شوي.
نجرب عليه.
Okay. So then we just let, we wait there for 3 minutes, let the body bleed. Okay.
And sometimes based on the amount coming, so we can.
Yeah. So for teaching purposes, I made the cuts very superficial. I've made them very separate, so quite far apart, not near to each other. So yeah, few number. It's a large cup size, but I've got a small number of cuts, just for teaching purposes. In clinical practice, depending upon how the patient has reacted, so maybe in the second session I can do more cuts. I can do, and slightly closer together as well. As you can see, I've left nearly 2 centimeters apart. We normally advise 1 centimeter distance between each cut, 1 centimeters above vertically and horizontally. आप कैसे हैं ठीक है? कोई मसला तो नहीं? Okay.
When you do the cut, it's not important how much blood comes out. Because initially when the patient is not used to cupping therapy, you might find the blood is very thick, it stagnates, not a lot of blood comes out. Subsequently, when they have more cupping sessions, you find more blood comes out. There's no need to cut deep. The benefit is in the whole process. The benefit is in one part.
Not outside.
Most of the patients, when they say they have a little blood, they say, why? I need more blood. More.
This is
Not necessary to
bleed so much.
More blood.
I think
You didn't apply the second and third at the same time.
second and third cup at the same time. In clinical practice, I do, but for teaching purposes, at the beginning, 1 cup at a time. Once you're confident and you're experienced, of course, you can do more. That will not bleed that much. Do you understand? I will not do 9 heavy cups to bleed heavily, because it will cause, even though there's no volume loss, it causes blood diversion. So the heme diversion will cause people to faint. Okay, so now I'm going to remove the cup. Can you sit up?
Just explain
Up,
the
that's a
patient
better.
very slowly. Very
So I get the patient to sit up vertically, because then you get less likely for the blood spillages. As you can see, I've got a
Protection.
protection just in case there's any blood spillage on the floor. And if you need another gauze on the top, you can do that to support the top like that. I will release the diaphragm. Once you release the diaphragm, the blood will spill down to the bottom. Close it again so you minimize the risk of spillage. And then in a single swoop, like that. And then you don't touch. Okay. It's up to you which technique you prefer. You can clean bottom upwards or top downwards. For teaching purposes, we teach bottom upwards. Okay. Could I have that? If you can see there's some blood outside, what I would like to do is, before I apply that, just wipe it, because it's cleaner for the patients. So single use. I'm not touching the area that will touch the patient. I will take that and wipe like that. Is that the antiseptic? That's clean.
Away from the small, the circle area that we prick it.
Yep. Yep. Now I will start in the middle and do in a clockwise motion, like that. Okay, in and out. Where's the bandage?
The dressing.
Thank you. I've got two lovely assistants. I should.
Some patients they have energy from this type
Or bandage.
for bandage. Yes,
Allergy.
allergy for yes allergy.
Yeah.
Some people they. Have
That's why in the consultation we ask them,
That's
do
why
you,
we
do you,
use offside.
you use?
Offside. Spray
Spray.
offside.
Okay.
It's better because sometimes they have.
You can use that, but most people know about their allergies. So when you do the examination, you ask them beforehand, do you have?
If he do eczema, but most of people they can know if he have allergy from this. He didn't know if he
I
have
see.
allergy from the bandage.
Okay, they will normally know, but if they don't know, then yes. So we check with the patient, everything is okay. I dispose everything.
How long he will keep this? He's asking.
Okay, so we just 1 second. I've got 3 questions simultaneously. But after we finish, we tell before the procedure, the patient is aware of pre-cupping therapy preparation during the procedure and after the procedure. Normally, after the procedure, we remind them again to leave the bandage on for at least 24 hours. That's
For 24 hours.
24 hours to minimize the risk of infection. In particular, take care with diabetic patients and the elderly or patient on blood thinning medication. We also tell them to avoid a heavy meal straight away. So we tell them they can eat fish and they're able to eat fish, vegetables and salad. It's okay, but dairy products like
The
cheese,
fish is good, the fish?
fish is okay, but red meat and heavy meals, milk and yogurt and things, we tell them to avoid that for the first day. In addition, if they notice anything, if they notice a temperature, if they notice any rash, if they notice excessive itching, then go to the doctor to get checked. If they notice any temperature changes as well, go straight away because there's a risk of infection. The risk is very, very low, but it can happen.
I read in some books that this scratching increase serotonin hormone.
Yeah.
Serotonin hormone is hormone of happiness.
Yes.
Therefore, if increase the level of serotonin, this will be okay for the patient. But this scratching increase this secretions.
Serotonin and also the endorphins, so endorphins as well, so the patient feel much happier. Yep.
Also, I read in some books that the red blood cells survive about 3 months, then distracted.
Yep.
In any person, the red blood cells survive 3 months, then distracted.
120.
The liver and spleen
Okay.
take 90% of this destroyed blood.
Okay.
The 10% blood stagnate this area. Because
Yes.
this area, no movement. Your head, you move. Your arm move. But this area, not therefore stagnation of blood.
I don't think it's stagnation is because of lack of movement, because people do work on lifting. It's because of weakness in peripheral circulation. So the blood vessels in there have a very low. Yeah, it stagnates there. It's a weak circulation volume.
Therefore الحديث الصحيح احتجم الرسول على الكاهل والأخدعين. على كاهله هذا كاهله والأخدعين هنا الأخدعين. هذا الكاهل هذا الأخدعين.
The prophetic signs.
Like we said, like
على كاهله على كأن على ظهره هو.
Okay, like we said, there is difference of opinion regarding the points. You can choose whichever one you feel more comfortable with.
Yeah.
We don't want to go into any philosophical debate, but we choose these points and C7.
الإسراء والمعراج.
Okay, sorry doctor, we have time restriction. Can we, Saf, will everybody practice now?
No, so split into 2 groups. So half the group is going to practice here, half the group is going to practice at the back. Just put your equipment you need on the side, and then I'll take the trolley.
The equipment that we need on the side.
You can put the trolley in the middle.
I would just make it here on the side.
This is really telco-y.
Do you need anything?
Okay. Are you ready to go?
So can you just demonstrate? Half the group come to this side, half the group here.
زي ما قال لك استني خليه يشوفك عشان
I'm coming.
We're going to sterilize the area.
Okay. Okay, that's fine. No, you don't touch that again. Once you sterilize, you can't touch.
Sterile again.
So you have to start again.
Sterile.
So it's gonna be here, and then take like this.
Yeah.
In between.
Another goes.
Yeah.
It's to be clockwise, clockwise.
It doesn't matter, clockwise, anti-clockwise, top to bottom, bottom to top, whatever you provide. Sideways, just one direction.
One direction.
Why it is smaller?
I want to use the massage first.
You want to use massage first?
Yeah.
For massage, then you need to put oil on.
Oil.
Because
Oil.
yeah.
Hot oil. Okay.
So who's first?
So Dr. Kalim, so each time we want to do hijama, we need to do
That's enough.
massage first.
So what do you do?
Is it necessary?
No, you don't have to. It depends on your intention to trade.
Check.
Yeah.
Okay.
So it's on secure, right? Yep. Secure.
No need, there is no need.
Give it for 5 minutes, right?
3 to 5 minutes. Yeah.
There is no need to do massage first.
Only if there is clinical indication. So if you think he will benefit from muscle relaxation first.
For example, there's muscle pain.
Yeah. If he says I've got really sore pain here and it's really tight, I
Can
can't.
I do the massage here?
Yeah, you can.
Finish here.
Sure.
Dr. Kalim, one more I want to ask. If the skin color changes, how can we explain? Sometimes patients develop like hyperemic. Sometimes they will like slightly bluish.
If the skin color goes blue really quickly, then you want to take the cup off straight away, because as soon as it starts going blue, the skin will start bruising very quickly.
خلاص خلاص بس
That
الفرق.
means we need to
Yeah.
بس
avoid
الفرق
the
شيل.
bluish color.
الفرق.
Okay.
بس يلا حطها هنا. اوكي. بسم الله. خفيف خفيف.
Wait. So you want to stretch the skin first? Just but don't touch the area. And wait, just 1 second. 1 second before you start. Sorry. You check the longer lines. Which line you got the skin contour? So the skin contours are
Okay, like that.
like that here. Everybody's varies. Everybody's thing is different. So you want to check. So you want to make the cuts. Make
Follow.
no vertical. It's going to be. It's going to be 45 degrees this way.
We need to follow the line.
Okay. Okay.
Try to just dab. Don't scratch. Yep, like that. That's better. Okay, that's enough. That's enough.
واحد اثنين ثلاثة. Enough.
And no, twist from here, just in case, because. Okay, let me
Check
screw this.
الكب.
Yeah, just check that's on properly. That's fine. And if the patient is bleeding well,
How are you? Good? Good? Communication.
excellent. So if the patient is bleeding well, I would normally just take the tissue and just leave my hand underneath, just to minimize any risk. But you can do that if you feel there is a need.
Good?
कैसे हैं आप ठीक हैं?
ठीक है?
ठीक ठाक.
ها كيف؟
ها؟ اللبن gloves.
يا دكتور هذا يجوز الدكتور محمد دكتور كريم كان قدامي
यूज कर रहे हैं
जी.
हर किसी भी यूज कर सकते हैं
हाँ?
हर किसी का किसी भी यूज कर सकते हैं
नहीं. हाँ ये
जो है
I got more blood than you did. in this one. Is it okay?
it's fine. It depends on the number of cuts. I made only 6 cuts. That's
I made probably 10.
yeah. So I just did a few to teaching purposes, but it's okay. Your cuts was fine.
I used to see my grandmother doing it. She used to put the cups with fire and then
Put it on, yeah.
suction.
It's very good for dry cupping and fire cupping, very good for respiratory problems, bronchitis and respiratory diseases. Cystic fibrosis children is very good, yeah.
With the fire.
With fire. But at home, you know. Yeah, that's okay. You can remove it. No, not with that. Take your.
هذه هم تكنيك لانه لو نزل الدم في بعض
Okay.
المختبرين يرسبوه. ايوه.
Okay, excellent.
Very good.
Well done. Okay, straight into the
خلاص
bin.
هذه كلها.
That's it. Then you will put the bandage on and the cream on. No, not like that. Anything that will touch him has to be sterile, so it shouldn't touch your glove again. You will lift that side and apply the cream on the other side. Excellent. Very careful, huh? We have to for teaching purposes.
Yeah. That's the way to do it.
Excellent.
Excellent.
Well done.
Go
MashaAllah.
ahead and do
Dry cupping?
the massage.
Yeah, you can do that. So. Okay.
If more blood's coming out, that means more toxin is excreted. Is it?
No, it depends on the peripheral circulation. It depends on the strength of the circulation. If the circulation is good, it means more blood will normally come out. If the person is physically active, they bleed more, not because of more toxins.
More toxin.
No. Can you see? You can take the pump off. Take the pump off. Now manipulate with your hand, with one hand, in a relaxed manner. Yeah. Can you feel that? So if you have tense areas like trigger point, myofascial trigger points next to the bones, you can manipulate. Where there's no oil, you will find resistance. And you don't want to push where there is no oil because it like burns the skin. It's uncomfortable for the patient. Whereas that is quite relaxing and soothing. After a few moves, you will see, if you can feel the skin temperature is quite warm there compared to the rest. It warms up quickly.
So this massage, you can do circular, horizontal,
It do-
the fibers.
It depends on the patient's muscle, the state of the muscle. If the muscle is really tight, you can do it a few times. Depends on the condition as well. If they've got a deep muscle trigger point, then you have to do it for a longer period of time. If it's just a superficial one, you can do it for a few 1 or 2 minutes.
Thank you so much.
You're welcome. Well done.
Okay.
ठीक है भाईजान. Okay, are you next?
He's a
Do
professor
same time.
Of course.
in cupping.
He's professor in cupping.
MashaAllah. He's professor in many things. हम? हाँ जी, क्योंकि इन्फेक्शन का खतरा है. और हाँ, यहाँ सऊदी अरब में हेपेटाइटिस बहुत ज़्यादा है, इसलिए एक बार इस्तेमाल करें फेंक दें. हर एक चीज़ एक दे इस्तेमाल करें फेंक दें.
يلا سير. الو سير.
Sorry to ask.
Sorry.
About the color of the blood that coming out. Sometimes there is too dark. Sometimes it's quite light. How
The
to
color of the
explain?
blood varies on the amount.
Going for kahel.
It varies on the how quickly it clots. If it clots very quickly, it goes dark very quickly. And some people who, if it goes dark very quickly,
You want to do massage?
you can see that they have a higher clotting factors inside. Higher clotting factors inside. Maybe they have some pathology, but that's the only thing you can see. You can't say this is red and this is white, this is infection, this is no. It's about clotting ability. Some conditions make the blood clot quickly, some conditions make it clot slowly. The darkness of the blood is only a reflection of clotting factor.
Clothing, that means
That's it.
that
Because
doesn't,
as
doesn't
soon
show
as
the toxin contents.
no.
لا غلة.
But indirectly, it may show a disease, like it clots quickly because it's got pathogens inside and dead cells inside. And do you understand?
Okay.
That's what it can show. And the reason for that may be because of some disease or toxins or heavy metals.
Maybe.
Maybe, do you understand? But it's not 100% the reason. Yep, are you okay to take it off? Yes, good.
Take care. No.
Yeah, the one that you said.
Yeah, so in the middle, the longer lines will be closer to, you have to squeeze to see the longer line. The longer lines here are nearly vertical. Can you see?
Okay. Yeah.
So in the middle, you can do the vertical incisions normally.
Longer line.
You are cutting with the wrong end of the blade.
Oh, this way.
Yeah, so that's enough here.
Good?
Enough?
Enough. Right.
I don't think you made any cuts on the top, but you will see when you make the section. Yeah,
Yeah.
because you used the wrong side of the blade,
Yeah.
but it's okay.
Otherwise, yeah.
If you want,
The one they use it in the videotape with Dr. Amir, I think we should have it here. So that's easy.
yes, it's
The one that you have.
yeah, it's just a cheap shaving blade. Like we buy 50 of them for £1 in England. They are so cheap.
But the box you put it.
Yeah, we put it inside the box.
Yeah.
We our assistants, they break them, prepare them, clean them, put them in the sterile boxes.
Okay.
Yeah.
So you no need to put in the cold sterilizer.
No, we do. So she prepares. Our assistants prepare them. Then they put in the cold sterilization. Take them out with the surgical tweezer, plier. Put in the stage clean box like that.
Think in your head how many cuts you want, maybe
Happy?
9 cuts.
Alhamdulillah. How are you? Okay?
Fine.
Fine. Wow.
Dr. Kalim, does it for the room temperature? Does not necessarily we put patient in a warm temperature so that the blood.
No.
No need.
No, if it's too hot, the patient will feel lightheaded. Like normal room temperature, between 21 to 23 degrees is normal.
People use hair dryer.
Why?
Hair dryer to promote blood flow.
Really?
Yeah.
Unnecessary.
Yeah. Hair dryer.
Like or not?
It's okay if see what your technique is.
Hair dryer. So
This is what we do.
Okay, but I recommend not doing that because if the cup is filled with blood,
It's full with blood.
you will have a big problem.
Yeah.
Okay. Yeah, so don't remove the cup with one hand. Leave everything together and lift off like that. Enough. Good. Do you see what I mean with the? Do you understand what I mean with the single cup? Because if the cup is filled with blood, it will spill.
Spill off. So, bismillah.
Good? Alhamdulillah.
Okay.
And تجي رجالي.
صراحة شفت المباراة كاملة ولا ما شفتها؟
كان مباراة
Okay, excellent.
برشلونة
Thank you
والريال.
very
ما- هذا لا.
Well done, thanks.
بعد الهدف الأول والثاني خلاص.
ठीक है एक दो और साथी ने भी करना
كم هدف ثلاث
Okay.
4-2.
Okay, who is next?
Yes. Go ahead.
Where are you going to do?
You can do here or here. It's up to you.
This one what point?
Sorry?
What point? Still kahil. That means how to
No,
any
the kahil we finished. Kahil akhdain,
okay.
or they say akhdain is here, but we say it's here. You can do here for different reasons, but this is just to practice.
Or you want to do it the thigh as
This-
sciatica?
This is just to practice. So we.
pain, هنا, pain, no pain.
Let me say the head is not the main point.
Sorry?
The head is not the main point of the hijama.
جاهز.
No, not in my opinion. The head is not the main point. The main point is the back. This triangle.
This triangle.
Yeah. The triangle can vary from here to here. So here, or here. Anywhere from here to here, the triangle,
This is the main point.
the biggest points. Even acupuncture points agree with this as well. So first of all, you will sterilize the area. So before you sterilize, this is one thing that, for patient comfort, when you sterilize, spray, have this ready underneath, like that. So you get no spillage down the pants.
Yeah.
Do you understand?
Yeah.
ادونا كبزة كبيرة.
The fire. You do it for people with asthma and who else?
Cystic fibrosis, any restrictive chest diseases. Restrictive chest is very good. It really opens up the alveoli and encourages
Fire, huh?
the fire.
And then put it in here.
Yeah.
It
So
has to
any,
be glass.
yeah,
Glass
glass cups.
My grandmama used to do it.
Yeah, and it's very common in Eastern Europe to use for like pulmonary fibrosis, fibrosing alveolitis, cystic fibrosis, asthma, chronic bronchitis. You get the secretions out by stimulating the lungs using fire cupping.
3 minutes to 5.
Dry fire cupping. After you do fire cupping, and once the infection calms down, like if it's bronchitis and it's in infective stage, let it calm down, then do the wet cupping.
Then do
Yeah, because you want to clean the lungs first. Yes.
You use this one or shaver basically? What in your practice? You use blade?
No, I use the shaving normally in my practice.
Not this one.
But this is
You
just
know
for
how to
teaching.
use it? I never use it.
No,
I just want to try.
no, you can't use it because it's double blade. They brought the wrong ones. That's why we didn't show, because they brought the wrong ones. We have single blades. Tomorrow we will bring them and show you the single blades.
It's easier than this.
Much easier. Much easier because you've got full control of the blade.
I've been Lancet 3 multi-head.
Plastic.
Ah,
New one.
you're joining with us? Good.
خش عليك دكتور طلال.
خش انت.
Okay.
Are you happy with the coloring, color change? Okay.
خلاص.
So you can.
Remove.
فين حقتكم الترول؟
Yeah, they're taking the trolley. So I'm assuming this is sterile for them.
تبي لا تكون غلط زي
So stretch the skin.
Like this, right?
Yeah.
45.
Okay. So again, it's about 45 degrees here. So if you look at the Langer lines, can you see them thin lines across? They're nearly horizontal. Can you see? Yeah. So when you cut with these lines, so all the surgeons, yeah, this is the same way the surgeons make the incisions to minimize the risk of scarring. Yeah, stretch like that so you get better cut because the skin can be resistant.
Good.
Excellent.
Yeah, شوف ما في pain. Here there is some pain.
Just small.
Yeah. Tap. That's enough.
Do it next.
Can you use the
No. 2 points you lost.
The metal. The metal.
I'm showing the wrong technique.
He's saying don't do this. Don't do this. This is what he was saying.
You will lose 5 points now.
No problem as a surgeon. Use a needle holder and then prick. That's okay.
Needle holder, yeah.
Great,
Yeah,
والله.
because this
Beautiful.
is very,
Take a picture for you.
it's very dangerous and it's
Take
very
picture.
effective.
It's
because
beautiful for
sometimes
you.
prick yourself when you use
Yeah.
يا محمد خذ صورة للعمل والله very nice.
والله.
والله very good.
Are you happy with that?
Yes.
MashaAllah.
You are happy?
I'm happy if you're happy.
No, I am والله so happy with this.
MashaAllah.
Do you think it's good or no?
Yeah.
Very nice.
You
Happy?
could take it from the side, you will get a better, because the light reflection will.
No, I am in MOH, Minister of Health.
Doctor, do you practice doing like
We are two.
sauna? Can we please sauna before this one hijama to promote the blood flow?
No,
No.
Yeah?
Is
There's
it
no
good
need.
practice?
no, there's no need, no need. Because if you apply dry cupping beforehand, if you want to promote the blood flow, if it's like a diabetic patient or eczema patient, you want to promote blood flow, dry cupping has more quicker and more stronger effect
Dry
than
cupping, you
sauna.
mean massage.
Yeah, massage cupping. So just do it like that in that area, you get a warm response.
Oh, that's enough.
That's enough. It's stronger than sauna. Sauna is good on a different day.
Come on.
Okay.
Sorry, sauna.
Sauna is good on a different day.
Oh.
Do you understand? I recommend sauna, but not with cupping
You
therapy.
want 2 also?
I'm next.
Are you next? Good.
Like this, you want this, and you don't need this cutting.
Okay.
This is
That's it. Chuck it away. No, you can't use that. Khalas, you can't use that. Chuck that. You can use. You can put it on there. Anything that you've touched, don't touch it back onto the cuts. Okay, good, enough.
Okay.
Have you done that?
ايش بك؟ والله ما شاء الله من اول مره بدعت.
Excellent, well done. Next.
Last one.
Save the best till last, huh?
I hope so.
Okay, you can do the small one. Is there a big one?
فك البوكس هذا، شوف البوكس هذه فاضي. Use.
Okay.
Big one.
كنا ठीक है हाँ ठीक है कोई मसला नहीं.
ठीक है.
First of all, we came with chloroxidine daily.
Yes. Just grab one sponge. Leave it under the area that you will treat. So you're going to spray here. So leave it under there and spray in the area. Yeah, like that, and then just wipe across. Excellent.
وقفت انت التسجيل خلاص؟
Okay. 2 minutes to be dry.
No, it's dry. It's fine. It dries instantly.
Okay, yeah. اسحب بسرعة.
Okay, yeah, that's fine. Take it off from, because this comes loose for some reason. That's fine. Good.
Nobody left-handed.
How was that? Okay.
Nobody left-handed.
No.
Left-handed? No.
ما في بليت هنا في بدون بليت بليت.
Just pull it in.
Yeah, to release, just pull.
For chronic headache patient or migraine, do you recommend to do scan first or can do straight away hijama?
Scan first, CT scan. Normally in our hospital, everybody that has a headache gets scanned. This is the routine.
Chronic headache, that means need to
Chronic headache, they get scanned. So everybody comes with MRI. Everybody comes with MRI scan to me. They already have it before they come to me.
45.
Don't, yeah. So if you, it's hard here because of the adipose tissue, but if you squeeze him, you can see the longer lines are like that. So you will scratch in that direction.
This direction.
Yeah. So it's going to be a tap, 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 tap like this, not like that.
Why did you got this one up a little bit? We should have got it down.
They did. I mean, this is how they practiced.
But they should go down near the inner sacral, right?
No, because this is the treatment for they're not treating any condition. They're just practicing the technique.
No, I'm talking if you have some musculoskeletal pain, then you should go down a little bit, right?
It depends on the pain. So sometimes you can have a trigger point here. You can have facet joint problem here. You can have many problems here. You can treat a different area. So you can treat. This is the lumbosacral junction. So you can treat lumbosacral problems, lumbosacral plexus injury. You can treat different things. If it's like sacroiliac joint problem, you will treat here.
Good.
So
What about if someone has metastatic CA and is being cured, half cured? You should do those trigger points 5.
Those 3 points?
Yeah. And go
Yeah.
down colonic
Yes.
cancer.
Yeah. Colonic cancer. Yeah.
Also down.
I would. Yeah, you would also go down there and for the liver points across here. Yeah, very good.
At the middle part. Huh?
Yeah, so the liver is roughly T10, T12 nerve root.
Below it.
So here, across this line, this normal fat line, that's the bottom of the rib cage. So that's where the liver normally is.
Okay. So you do the cupping here down.
Yeah.
Down
So
this area.
here, You can stimulate the sacral plexus, but you don't really need to because the nerve supply for the colon is T from T7 down to to L1, maybe even T6 to L1. Yeah.
This area, in this area, huh?
Yeah.
In this area, this area, this area.
But does one of your patients have that?
Like this, doctor?
Yes. If you release.
That's
Another one? Another from above?
Yeah, the above one is just a precaution if you feel you need it. If you don't feel you need it, you don't have to.
I think we did need it.
Okay, then so just release that. Excellent. And keep your thumb there to support. And just do that and swipe up. Excellent. Excellent. Sorry? You don't like it like this? You like to cover both?
Both and then see.
Yep.
شوفين انت لما تجي.
Okay.
يلا دكتور تبغى انت؟ يلا يلا يلا.
بقى لي مكان. No place to place a cup, huh? Right there.
There's 2 places left.
Can do it on his head.
How are you? Good? Good, alhamdulillah. Steps are fine.
This when I do dressing.
Yeah, just pull it off like that. Huh?
When I do dressing for the patient, the surgery was problem that gloves stick in the bandage.
Yeah, just hold the plastic and rip it out.
The oldest problem I think I remember we had 1 month. I was doing daily dressing with the patient. He has sacral, very big sacral
Ulcers?
ulcers, bid ulcers, bid sore, and he is paralyzed. So I'm the one who was rolling the patient. It was very difficult. I remember it was very big. I think
Did you
about
use a
half
vacuum assisted closure or the
We do
normal?
vacuum, but I use it with chlorhexidine. It's all the time, daily dressing.
Okay.
I clean it all the area.
एक और 2 और कप्स रहेंगे, एक इधर करना है एक इधर करना है, ठीक है? बाकी 2 बाकी रह गए हैं, ठीक है? Okay, okay, you're fine. That's good. Well done. Thanks. Okay, Qutayda, your turn. Can you take your bag off?
Good idea.
Because they've got you on camera, they will think that you're a tourist.
No.
Get the plate.
Tourist doctor.
So give it to me. Fun.
Yeah. I can take.
Yeah. I will try to do that. This one I have.
What are you after? Cups. Spray.
وين حتروح؟
راح
هنا.
Okay.
راح ابدي عليك حجامه.
بسم الله.
In case of fainting, just put it
ما
down.
تبغى مساعدة انت ما شاء الله؟ ما في؟
Who is this? Hello, assalamu alaikum. Alhamdulillah. Abu Yusuf, how are you? Alhamdulillah, good, thank you. Yourself? Oh, really? MashaAllah, tabarakallah. Congratulations.
What do you want?
Oh, MashaAllah. Good. May Allah bless her and give her health and... No, it's okay. I'm going on Tuesday afternoon. Yeah. Inshallah, barak. Okay, great, Abu Yusuf. Thank you so much. Tonight, inshallah.
You know? You know?
All right, I'm coming with Hamad Ad-Dosri. Yeah, we will come together, inshallah, tonight. Okay, all right. No, this is my friend's number from Qatar. This is not his number.
vertical
Okay. All right, sure, I will. Okay, barakallah fiqh. Thank you. Okay. Take care. Assalamu alaikum.
Just go and see how the ladies are doing.
Anybody else need to do
Yeah.
hijama?
So you can see the longer lines, right?
Yes.
Okay, so they're at that angle. Yes, you can, if you think, yeah, just stretch a little bit, mild stretch, yeah, like that, that's good.
Very good.
Just remember the procedure tomorrow. Tomorrow you will be tested.
Okay.
In this case, just use let's do this.
Excellent. And then we wait. Then we wait. Tick tock.
ها نسوي ثاني كمان.
Until the mouse runs up the
والله
clock.
محمد انت خطير يا محمد. ايش تبغى؟ صور وانت صور بس. صور قبل ما تقدر انت عشان ولد الجامعة ونحن اولاد الصحة اولاد المغضوب عليهم.
For the
عقمت؟
spot. No, I'm not gonna cut.
يا
No cutting. هذه بس.
It's okay. It's an ingrowing thingy.
Yeah.
The sweat gland is gone. It got sweat gland infected and you've grown back inside.
Yeah.
ما تجي عليها.
Okay.
ما في من القوس الكبير ترى انتبه. تبغى واحد فوق؟ ليه بس ضوبتوه؟ لا هو عشان طويل. كده صوروا الحين كده هنا عشان يقولوا الجامعة ما عندهم إمكانيات.
Sorry, my hands are covered with gloves.
One more, just one more. Two. Okay, all right, thank you.
Okay,
Thank you.
Easy? Good? No problem? Alhamdulillah.
ठीक है बस एक और रह गया ठीक है आखिरी आदमी
هذا كم ساعة يقعد بدون shower? He'll take 12 hours?
1 day we say don't have shower for 1 day.
You told him?
Yes. एक दिन आपने ये उतारनी नहीं ठीक है नहीं रात को ना उतारें कल सुबह आप उतार सकते हैं ठीक है कल सुबह كيف حالك؟ الحمد لله كويس الحمد لله كويس الله يشكرك ان شاء الله Where are you going? ها
مع السندور الا كده كنت مصور. بسم الله. Good? Are you good? You want to help? Are you good? Feeling happy with me? Okay? Very good.
As happy as rain. Okay, you're happy with the skin color change? Excellent.
Yeah. The same.
Yeah, okay. Are you left-handed?
Yeah, the
There is-
previous one, the
there-
only
there-
one in the group.
There is always one, right?
Yeah. Ah,
You're doing, can you stretch the skin? Stretch it like that, yeah. That's better for you and better for the
I
patient,
think.
okay. Sharp spin, yes?
okay? Feeling okay? Okay, sir.
In your practice, do you change the site based on the
طب بعدين
disease?
فين اخر الصور؟
Yeah, it varies.
Very.
And change the site according to symptom progression as well.
Okay. What about the in front? What type
Yeah,
of
I find that
condition?
if it's an internal medicine disease, I normally use the back. If it's localized, I do the front normally. This is my general approach. Of course, it varies, but
What's your opinion about the malignancies cancer? This thing you do?
yeah, I do. But I always work with the oncologist because I work in a hospital.
Let's say they allow to do.
Yeah, I
breast
do.
cancer.
Yeah,
So
yeah, yeah.
normally, what type of cancer do you work with?
I normally work with mostly
Good, Salah.
blood cancers,
Oh, blood cancer.
hematological cancers,
Hemato-
also bowel cancer. Quite a lot of patients with bowel cancer, pancreatic cancer.
pancreatic cancer.
عشان اللي
Yeah,
عندي.
because there's always palliative management for pancreatic cancer. They only have 6 months, 8 months
So
survival.
for the pancreatic cancer, where you do?
I do the general points, and I also do the pancreas. I also do the back for the nerve root origin of the pancreas. Yeah.
What about breast cancer?
Breast cancer, it's upper back and locally.
Locally.
So I will do on the around the area, not on the
Mesh.
site,
Yeah.
but around the area. Yes, very good, brilliant. भाईजान बहुत बहुत शुक्रिया.
Sorry.
ठीक है.
lie down a little bit. No. خليه ينام شوية. Let him lie down. لا خليه ينام. تعال ولدي.
अब ठीक है. ठीक है भाईजान.
لا يا أبوي والله ترى الميكانيزم heavy. ما هو.
It was light cupping, so he's okay with that.
Do we have extra cups?
Sorry?
Do we have extra cups?
For
For me.
for now? No. I don't think so. I think we have.
All finished. خلاص. Food.
Food?
يلا.
No, it's teaching now, not food.
Teaching?
Food at 1 o'clock.
No coffee, no smoke, nothing.
I think break for 10 minutes maybe, but
Okay.
we will check with the sisters,
Okay.
with the ladies.
يلا smoke. سمك.
Smoking,
Smoking.
never a good idea.
Can, almost 40 years.
Almost 40 years.
42 years. Since age of 18.
You are working in the Ministry of Health, man. What are you advising people?
All this they are advising and
Do as I say, not as I do.
خلاص. ايوه شرح له الدكتور كريم 6 hours no food. 6 hours هناك more.
No, he can eat.
Eat he can.
Yes, eat.
6
अब
no.
no, खाना खा सकते हैं अब इंतजार ना करें अब भी खा सकते हैं लेकिन दूध वाली चीज़ या गोश्त अब आज ना खाएं मछली चूज़ा खा सकते हैं और सब्ज़ी खा सकते हैं लेकिन दूध और गोश्त ना खाएं एक दिन के लिए बस ठीक है हाँ जिस्म के लिए बहुत भारी होगा भारी हो जाएगा इसलिए हम कहते हैं
तो ये जो लगा दिया ना इसके वो जो करने के बाद
जी
उससे कोई वो नहीं है ना रिफ्लेक्ट नहीं उससे कोई दर्द तो नहीं होगा
नहीं दर्द नहीं होगा आप पूछ सकते हैं अभी आपको कोई दर्द है? नहीं ठीक है। हाँ कैसे महसूस हुआ आपको? हाँ कैसे महसूस हुआ? कोई कुछ भी नहीं हो? नहीं ठीक है। Saf, Lala, did everybody practice?